In the previous video, we explained what knee osteoarthritis actually is. In this video, we'll look at what research and clinical guidelines suggest actually helps. But before we can even get to what helps, there's something you really need to understand first, and it's this perplexing mystery at the very heart of osteoarthritis.
So what is this mystery? Well, it's this central question. Why can someone have an X-ray that looks, well, terrible, but they feel totally fine? And on the flip side, why can someone else, whose X-ray looks pretty mild, be in absolute agony? This disconnect has puzzled people for years, and the answer is absolutely fascinating.
Okay, so to start cracking this case, we have to look at the evidence. What are doctors and clinicians actually seeing when they look at an X-ray of a knee? These are the conventional clues they've used for decades to grade how severe the arthritis is.
So, one of the first things you might see mentioned on an X-ray report is this word, osteophytes. You've probably heard them called bone spurs, and they're basically just what they sound like, little bony growths that can form around the edges of the joint. For a long time, these were seen as a sure sign of the joint reacting to stress.
All right, along with those bone spurs, the other big clue they look for is something called joint space narrowing. Now, an X-ray can't actually see your cartilage, that slick, cushiony stuff on the ends of your bones. But what it can see is the space between the bones. And if that space starts to shrink, well, the assumption has always been that the cartilage must be wearing thin.
So for the longest time, the thinking was pretty simple, right? More bone spurs and less joint space must equal more pain. But then, researchers had this brilliant idea. They decided to take a look at the knees of people who had zero pain, none at all. And what they found, well, it turned everything we thought we knew completely on its head.
And this is where it gets really interesting. What if these things we've been calling damage or abnormal findings on an X-ray are actually just normal, kind of like getting gray hair or wrinkles as you get older? What if they aren't the problem we've been making them out to be?
You might want to sit down for this one. A huge, major review, and we're talking about MRIs here, which are even more detailed than X-rays, found that a mind-boggling 43% of adults over 40 with no knee pain whatsoever had findings that would be diagnosed as osteoarthritis on their scans. Think about that. If those people had pain, those scans would have been blamed immediately.
And this slide, wow, this just drives the point home perfectly. Check this out. One study compared MRIs from people with knee pain to those without. Okay, so 91% of the people in pain showed some cartilage damage. Makes sense. But an incredible 88% of the people with no pain at all also had cartilage damage. The difference is tiny. This is the absolute proof that the picture alone is a terrible, terrible predictor of what you're actually feeling.
So if the damage in the joint isn't the whole story, then what is? Where is the pain actually coming from? Well, this question led scientists to look past the knee itself and zoom in on the complex system that actually creates the experience of pain for us, our nervous system.
And a key idea here is a process called central sensitization. Now that sounds complicated, I know, but the best way to think about it is that your nervous system has a volume knob for pain. For lots of different reasons, in some people that knob gets cranked way up and it gets stuck there. Your whole system just becomes a bit overprotective, a bit hypersensitive.
So how does this actually play out? Well, let's say you get a small signal from your knee, maybe just a minor bit of irritation. That signal travels up your spinal cord to your brain. But in a sensitized system, the brain and spinal cord don't just receive that signal, they amplify it. It's like turning the bass way, way up on your stereo. The final output, the pain you actually feel, is much, much bigger than what that initial signal from the joint warranted. And boom, this concept perfectly explains that group we talked about at the start. The people with a lot of pain, but their X-rays look pretty mild. Their pain is 100% real. It's just being driven more by the sensitivity of their nervous system than the actual state of their knee joint.
But wait, there's more. This central sensitization isn't working alone. It has accomplices. Research is showing us there are a whole bunch of other factors that can influence how sensitive your nervous system is and ultimately how much pain you experience. Things like poor sleep, feeling exhausted all the time, or dealing with a lot of stress and anxiety. All of these things can literally turn up that pain volume knob. They actually share some of the same wiring in the brain as pain. And this is why two people can have the exact same knee X-ray but have completely different experiences with pain.
Okay, so we've looked at the X-ray evidence. We've brought in the nervous system as a key player. So what's the final verdict in this case of the X-ray versus your actual pain? Well, the conclusion from all this modern research is actually really clear, and I think pretty empowering.
And here it is. Knee osteoarthritis is a clinical syndrome, not an X-ray finding. What that really means is that the diagnosis should be based on you, your experience, your symptoms, how you're able to function day to day. The X-ray, it's just one small piece of a much, much bigger puzzle.
I mean, listen to this quote from a major medical journal. It says it all perfectly. Knee pain is an imprecise marker for what's on an X-ray, and what's on an X-ray is an imprecise guide to whether you'll have pain. They are just not tightly connected. They are two different things.
Now, hold on. This does not mean we should just throw out all the X-ray machines. They are not useless. It just means that they have a very specific and, frankly, pretty limited role when it comes to diagnosing and managing typical osteoarthritis.
So when is an X-ray truly necessary? Well, the clinical guidelines are super clear on this. They're recommended when a clinician needs to rule out other, more serious conditions. We call these red flags. Things like a major recent injury, symptoms that are getting worse really fast, or signs of an infection like a hot, red, swollen joint. The whole point of the X-ray here is to make sure it's not something else.
And this brings us right back around to the most important question of all. If that picture, that film, that X-ray, if it doesn't define your pain, your function, or your future, then what does? And that question right there, that shifts the entire focus away from a picture you can't change and puts it right back onto the many things that you can.